Assalamu alaikum. Our lecture today about investigation of genitourinary disorders, and we will talk also about the most common method of treatment of urinary disorder and most common instrument and endoscopes used for diagnosis and treatment of genitourinary disorders. First, we will talk about the laboratory investigations, and the first laboratory investigation and the most common test done in genitourinary disorder is the urinalysis, or what we call general urine examination. This is done by taking a midstream urine sample. So the first few cc of the urine is discarded because it contains bacteria and cells from the urethra, and to avoid contamination of urine sample, we discard the first part. Then we take the second part of the urine in a clean container and continue voiding. This urine sample is subjected to physical examination, chemical examination, and microscopic examination. Regarding the physical examination, we examine the urine sample for the appearance, for turbidity, for pH, and for osmolarity. And the chemical tests that done on the urine, like a Diagnostic test, which is a strip, contain a reagent used for measurement of urine pH for the presence of glucose, protein, blood, bilirubin, urobilinogen, ketones, and nitrite within the urine sample. Regarding the urine pH, which is normally between 4.5 to 8, it's very important part of the general examination. Any alkaline urine more than 8 suggests infection with urea splitting microorganism as a Proteus, which lead to precipitation of a crystal and formation of a stone. A protein in the urine normally present up to 100 mg per 24 hour. The Diagnostic will measure only level above 300 mg per liter. Transient proteinuria is common, for example, after exercise, after UTI, or persistent proteinuria, for example, in glomerular disease. Glucosuria in patients with diabetes mellitus, and rarely in kidney crystalluria and in stone disease. For the presence of bacteria, we use a gram staining of the urine sample in case of usual bacteria, and Zell-Nielsen stain for TB bacteria, tuberculosis. OVA in case of schistosomiasis or bilharziasis. Culture of the urine specimen. The urine specimen cultured on the usual media for the presence of usual bacteria. In case of suspected TB, we need a special type of culture media called Lowenstein-Jensen media. In the presence of culture of urine sample, the specimen should be plated out promptly or refrigerated until processing to prevent multiplication of bacteria after voiding. Fresh urine is better for culture and sensitivity. Significant infection is present if there are more than 10 power 5 colony forming unit per ml, while count less than 10 power 3 colony forming unit per ml suggests contamination. If urine sample is taken directly from the bladder by suprapubic puncture, any growth of microorganism is considered as infection. If the urine sample is taken by urethral catheter, 10 power 2 colony forming unit per unit is considered as infection. Antibiotic sensitivities is also performed on the same urine sample for detection of the most effective antimicrobial therapy for the cultured bacteria. In case of suspected TB, we should culture the urine sample on Lowenstein-Jensen media, because TB bacilli not to grow on the usual media, and we take a 3 early morning sample of urine for culture. A blood test used for investigation of genitourinary disease include renal function tests such as plasmaturia and serum creatinine, and creatinine clearance, which is more accurate than blood urea and serum creatinine, and roughly it is equal to glomerular filtration rate. Hematological tests such as complete blood count for detection of anemia, such as renal impairment and case of tumor and chronic disease, white blood cell elevated in infection of the urinary tract, and some cases of tumors and chronic inflammatory disease. ESR also elevated in case of tumor, retroperitoneal fibrosis, chronic disease, and other certain disorder. Other tests, serum PSA, which is a prostatic specific antigen, which is elevated in case of a prostatic disease. Imaging tests for evaluation of genitourinary disease include KUB, which is a plain film of abdomen, kidney, urinary bladder. It's used for detection of radiopaque object within the urinary tract, such as a stone and stents, catheters, and others. For soft tissue masses within the urinary or pelvis, for gallstone 10% positive, and for phlebolith, which is calcified venules or wall of the venules in the pelvis, called the phleboliths. Calcified lymph node, sclerotic deposit in the bone, as in case of prostate cancer, which is metastasized to the bone as osteoblastic or sclerotic lesion. Other tumor like renal cell carcinoma, bladder carcinoma, when metastasized to the bone, give osteolytic lesions. These are plain film. On the right, KUB film show multiple radiopaque shadow in the left renal area, typical for renal stone, and pelvic X-ray on the left show a large radiopaque shadow within the pelvis, typical for bladder stone. Regarding the dye study, we have intravenous urography or IVU. After plain film, we inject iodine containing contrast media intravenously, and serial film are taken. This contrast media will be filtered by the kidney and excreted by the collecting system. There are several phases in the IVU, like nephrographic phase, excretory phase, and release phase, and then cystographic phase and post-voiding phase. In the nephrographic phase, during the initial 1 to 3 minutes after injection of contrast media, the contrast will be taken by the renal glomerular and proximal tubule and will appear as an opaque shadow involving the parenchyma of the kidney, useful for detection of any soft tissue masses within the renal parenchyma. Then biographic phase, or called excretory phase, after excretion of contrast to the collecting system, it shows the calyces, the infundibulum, the pelvis, the ureter, and the bladder, and use it for detection of any structural abnormality or filling defect within the collecting system. The post-voiding film is taken after the patient micturition. The procedure may be complicated by several complications, including allergic reaction to the contrast media, and even may cause anaphylactic reaction and death. Also, it is nephrotoxic, so it may lead to renal impairment. Ultrasound. It is the most frequently used radiologic technique in the urologic disorder. Almost all urologic outpatient departments are able to perform ultrasound immediately after physical examination. So it's considered as part of physical examination. After inspection, palpation, percussion, and auscultation, ultrasound is part of clinical examination in urology. There are different type of ultrasound study, like transabdominal ultrasound, what's we called real-time ultrasound. Also, we have color Doppler ultrasound for measurement of blood flow for vascular disease of the kidney as a tumor after trauma, in case of malignancies, and for in case of renal transplantation and renal impairment and surgical hypertension. All these can be, in this situation, we can use Doppler ultrasound to measure the flow and the velocity of blood within the vascularity of the kidney. Also, we have internal ultrasound examination, such as transrectal ultrasound and transvaginal ultrasound for evaluation of disease of the pelvis, like transrectal ultrasound for disease of the prostate, seminal vesicle, and for pelvic malignancies. These pictures of ultrasound show different renal pathologies as renal tumor, hydronephrosis, dilatation of the pelvis and the collecting system, color flow Doppler of the kidney, and transrectal ultrasound of the prostate. CT scan, multi-detector spiral CT, it enables reconstruction in different plane and biphasic CT angiography for detection of the any vascular abnormality of the kidney, any tumor, after bleeding, after surgery. PET CT scan, which is positron emission tomography, and CT, it's useful for detection of malignancies of the urinary tract, where the uptake of the positron emission will be increased, especially in metastatic disease, recurrence after resection, or for follow-up of the tumor after chemoradiotherapy. This is coronal section of CT angiography, show the left renal pedicle or arteries, and in the bottom of the picture is positron emission tomography PET scan, show malignancy with metastasis to the right hip, where the uptake of the dye is very high. MRI has a role in the evaluation of genital urinary disorder. It is used for evaluation of tumors, for example, tumor of the pelvis and the kidneys, especially if there is invasion or metastasis to vascular structure as the aorta or the inferior vena cava or renal vasculature. Conventional arteriography, where the dye injected directly into renal artery or veins. It uses in diagnosis of renal vascular disorder, tumor, trauma, or after surgery and the bleeding. And also it is therapeutic. It can embolize the bleeding vessel and stop bleeding. Iliac arteriography is used for assessing of pelvic tumor and trauma, and also therapeutic. We can induce embolization of bleeding internal iliac artery in case of uncontrolled bleeding from the bladder, what we call hemorrhagic cystitis, where the bleeding is uncontrollable by the usual maneuver. We can embolize the anterior iliac artery to stop the bleeding. Other radiological technique, for example, antegrade pyelography, where we inject the dye directly through needle puncture to the kidney and instill the dye in the renal pelvis, and this would outline the renal collecting system, the ureter down to the bladder, called antegrade pyelography. It's used if the patient has allergy to IVU contrast medium, or the patient has renal impairment, so we cannot give the contrast medium intravenously. Ascending ureterogram, this is done by inserting of catheter in the ureter by cystoscope or ureteroscope, and inject the dye through the catheter for retrograde evaluation of the ureter and collecting system. This also can be done if there is contraindication to IVU, or if the IVU is non-conclusive and it is invasive test and need anesthesia and endoscopy. Ureterography, ascending or descending, by injection of dye study into the urethra retrogradely, or by injecting dye study into the bladder and ask the patient to void to outline the urethra. It's called descending ureterography. This is used for evaluation of urethral disease as stricture, or in case of trauma and injury of the urethra. Cystogram, by installation of the dye into the bladder by catheter, or through the urethra, or through suprapubic puncture. This is used for evaluation of the bladder disease, as in case of trauma or tumor, and in case of vesicular reflux. Lymphography, following injection of contrast media into lymphatics in the dorsum of the foot, used to demonstrate iliac and para-aortic node in case of pelvic malignancy, but nowadays rarely used because it's replaced by CT scan. Radionuclide studies, this is by using an isotope material injected intravenously and show the uptake by the genitourinary structures. For example, renal scintigraphy, which is used for evaluation of renal disease, for example, obstruction of the kidney, or in case of vesicular reflux. Bone scintigraphy for evaluation of the skeleton for any metastasis from genitourinary disease, for example, in case of carcinoma of the prostate. Now, we will move to talk about specialized methods of urological treatment and instrument and endoscope used in the urologic diagnosis and treatment. Catheterization. Catheters are used mainly therapeutically to relieve urinary tension. Type and size of catheter and material used for the manufacturing of the catheter. Most commonly we use silicone material or soft silicone coated latex. Silicone is highly resistant to incrustation. It is inert material, more comfortable to the patient with less irritation and less infection. It can be introduced up to 4 weeks. 100% or what we call the pure silicone catheter can be indwelled for up to 8 weeks. It's better, but it is more expensive. We have several types of catheter regarding the number of way for drainage. One-way catheter, only drainage channel. It's used for installation of the dye or for measurement of post-void residual, which is replaced by ultrasound nowadays. It is used one time and removed immediately after ending of the job. So it is non-self-retaining catheter. We cannot keep inside the bladder. Second, two-way catheter. It is self-retaining catheter. A different method of self-retaining used, but the most common is Foley catheter, where the balloon is used for self-retaining. We inflate the balloon inside the bladder and we can keep the bladder, the catheter for a while. It is called self-retaining catheter. Three-way catheter, we have a three-way, one for drainage, one for irrigation, continuous irrigation and lavage of the bladder, and one for inflation of the balloon. Regarding the tip of the catheter, we have Nilaton catheter, where the tip of the catheter is straight round tip, and Tiemann catheter, where the tip is curved pointed tip. Size of the catheter. The size of the catheter is measured by a French or Cherriari. It measures the circumference, outer circumference of the shaft of the catheter, and every 1 millimeter equal to 3 French, or every 1 French equal to 0.31 of the millimeter. This is the Foley catheter with self-retaining balloon, and it has two-way, one for drainage and one for inflation of the balloon. It contains one-way valve, not permit the fluid to escape from the balloon. And on the left there is a urine bag connected to a drainage channel for collection of the urine. The indication of catheterization, usually we divide it to diagnostic indication, where we instill a dye for cystogram, urethrogram, for measurement of urine output in moribund patient, severely ill, severely traumatized patient after major surgery, and in cases where we need to measure the post-void residual urine. Therapeutic indication like relief of the obstruction in case of retention of urine after major surgery to the lower urine tract, as a prostatectomy or bladder tumor resection, and for stenting of anastomosis, as in cases of urethroplasty for hypospadias or urethral structure surgery. Also, therapeutically, we can use the catheter for drainage of abnormal fluid from the bladder, like pus or blood in cases of hematuria. Contraindication to catheter is allergy to material used for manufacturing of the catheter, has allergy to latex, in case of active infection in the urethra or prostate, and in case of injury to the urethra, it is absolute contraindication to catheterization. And also in cases of severe urethral stricture, because insertion of a catheter may create a false passage and more injury to the urethra. Complication of urethral catheterization, we have early complications and late complication. Early complication like trauma to the urethra, bleeding, injury, perforation of the urethra. Also we have dysuria and suprapubic pain. We have infection. We have also allergy to the material. We have failure to insert the catheter. And late complication like urethral stricture, if long-term catheter is inserted. Also metaplasia, dysplasia, and squamous cell carcinoma, incrustation of the urethra of the catheter and formation of a stone and the crust on the catheter. Also failure to deflation of the balloon is one of the complication of long-term catheter insertion. Two types of endoscope used for diagnosis and the treatment of different genitourinary disorder. We have rigid and flexible. The rigid stainless steel is used for manufacturing. It is more easier to use, but it is more painful and need regional or general anesthesia. And we use rod lens for the transmission of the image to the telescope and to the camera. The picture is more clear, but it needs anesthesia. Flexible, more comfortable to the patient. It needs local anesthesia, but it uses fiber optic fiber for transmission of the picture, so picture will be less clear, and also it is more expensive and more likely for fracture. We have different type of endoscope. Pan-endoscope. Endoscope uses for evaluation of the urethra, urethroskop, and the bladder cystoscope, and ureteroscope for evaluation of the ureter, ureterorinoscope for evaluation of the ureter and the kidney. Endoscopic operation that can be done through this endoscope, like lithotripsy, which is disintegration and fragmentation of the stone within the urinary tract, a transurethral resection like a prostate or a bladder tumor, 2RP and 2RBT. Nephroscope, which is endoscope used for operation inside the kidney, whether retrograde through the urethra or antegrade through percutaneous nephroscope. On the right is the rigid cystoscope, and on the left is the flexible ureteroscope. Nephrostomy is to create a tract through the kidney to the exterior, to the skin, by inserting a catheter inside the collecting system. It's called nephrostomy. So percutaneous nephrostomy can be done by first inserting a needle into the collecting system. Once the urine is drained, we insert a guide wire through the needle, remove the needle, then dilate the tract by serial dilator. Then over the guide wire we insert a pigtail catheter inside the collecting system. It is used for drainage of the kidney in case of obstruction, and for installation of the dye or drug inside the kidney for investigation or for a treatment of a stone or a tumor within the collecting system. And this is the nephrostomy tube. Biopsy of different genitourinary disease can be done, like prostatic biopsy, which is used for evaluation of prostatic carcinoma, and rarely in case of a prostatic inflammation. It can be done through a transrectal approach or transperineal approach by core needle, usually under ultrasound guide. Biopsy of the kidney, most commonly done for nephrologic disease like parenchymal disease as glomerulonephritis or nephrotic syndrome, and in case of renal impairment, and in case of impairment of transplanted kidney. It's usually done under ultrasound or under CT scan. Rarely it is used for biopsy of renal tumor because in case of malignancy it is not informative and may lead to seeding of the tumor along the tract of the biopsy. So rarely it is used. Thank you.